So you're about to turn 65. Congratulations. I bet your phone's ringing off the hook and your mailbox is about to explode with letters. Today we're going to talk about what you need to do when turning 65 to enroll into Medicare. So what you will need to do is you will need to apply for Medicare. Now you can do that one of three ways. You can go to your local Social Security office. That's right. Social Security will handle Medicare and will be the place where you need to go to apply for Medicare. Now, if you'd rather not go to your local office, you can also call Social Security. And the number for Social Security is 1-800-772-1213. That's 1-800-772-1213. Now, if you would like, you can also apply online at Social Security's website. That is simply www.ssa.gov/Medicare. Now, you do not have to apply for Medicare to go ahead and set up a Medigap or Medicare supplement plan, but you need to go ahead and have that done. So say, for example, this month is December, your birthday's in March. You can go ahead and set your Medigap plan up and just make sure you have your Social Security contact made and you apply for Medicare and have that in place so that it is in place before your birthday. So we want to also break down the different parts to Medicare. So there's basically going to be 4 parts to Medicare. So what we're going to do here is look at the 2017 Medicare and You book. So I'm going to turn here to page, I believe it's 15. Okay. And it will show you that there's actually 4 parts to Medicare. There's Part A, Part B, Part C, and Part D. Now, Part A is basically going to be your inpatient care. So Part A is basically your hospital insurance. It's inpatient care in hospitals, skilled nursing facilities are included here, hospice, and home health care. That is all part of Medicare Part A. This does not cost any premium unless you have not worked 40 quarters in your lifetime. In order to get Part A free, you have to have worked 40 quarters throughout your working lifetime. So, anyways, Part A is your hospitalization. Now, Part B, Medicare Part B, is basically anything outside of the hospital. It's going to be your doctor's visits, your clinics, any outpatient care, home health care, durable medical equipment, and many preventative services. That's, of course, very important, the preventative services. Part C is Medicare Advantage. Okay, Part C, Medicare Advantage, it usually includes benefits and services covered under Part A and B. However, Medicare allows a private insurance company to take over, essentially. It's ran by a private insurance company, but it must follow the rules of Medicare. We'll talk more about Medicare Advantage in a later video. And then, of course, there's Part D, which is your prescription drug coverage. Now, let's talk a little bit about that. There are many, many companies out there, they're regulated by your zip code. So, if you're in Houston, Texas, you may have a lot of different choices. Whether you're in Columbia, Kentucky, there's only a small amount of companies that serve that city. So it just really depends on your zip code as to the companies that serve that zip code. And that also goes for Medicare Advantage. It goes for Medicare Advantage and your Part D drug plans. Part D drug plans, some folks will shop by premium, and that's certainly a consideration. There are plans that start at $17 a month, and then they go up to, Part D drug plans can be $75. So there's all different price points. The average price is around $30 a month. What you want to do is have a professional enter all your drugs in to the system, or you can do it yourself. We made a separate video about Part D drugs that you can actually go to the Medicare.gov website and enter all the drugs in yourself, because the reason why that's important, we've always been told the bottom line is the bottom line. You might save $10 a month on a premium, but have to spend $100 more a month in drug cost. And what I have found is it is not one size fits all. Everybody's situation is different. Certain companies don't cover certain drugs. You may have a prescription drug that you need filled, and company A doesn't cover it, so you need to go to company B to make sure that all your prescription drugs are covered. So, like I said, we have a separate video on Medicare Part D, so take a look at that. So for 2016, the Part A deductible is $1,288. And then, you can go through and look at the different, co-insurances. If you just had Part A, if you just had Part A alone, you can see that, you have so much to pay going to the hospital, skilled nursing facilities, etc., etc. For Part B, Medicare pays 80%. You will be responsible for the other 20%. So these expenses can really add up. So what a lot of folks do is look at a Medicare supplement plan, otherwise known as a Medigap plan. Now, the Medigap plan covers those gaps in Part A and Part B. Medigap plans do not have anything to do with the Part D, but what Medigap plans or Medicare supplement plans do is join both together. Now, you can essentially have Medicare pay 80% and the Medigap plans cover the other 20%. So we're going to take a look here at the Medicare and You book, the 2017 version here. It says that all Medigap policies are standardized. Now, what does that mean? It means that Medicare or CMS, the Center for Medicare and Medicaid Services, standardize or set the standard, we could say, for the insurance companies to follow. Now, as you can see here, there are, A through D, F through G, K through N. Now, not all insurance companies will cover all these plans, but they are standardized. They can't differ from one company to another. So when you're comparing prices, you want to compare apples with apples and not apples to oranges. So as you can see here on the screen, there is all different letters. Now, that's not to be confused with Medicare Part A, B, C, and D. There's also A, B, and C, D Medigap or Medicare supplement plans. We will make a separate video breaking down the different types of Medigap plans. But for now, this has been Nathan with Meta65.com. If we can help you at all, reach out and give us a call at 1-888-245-1311. That's 1-888-245-1311. Have a great day. Goodbye. Like what you see today, subscribe to our YouTube channel or like us on Facebook at facebook.com/SaveOnMedicare or give us a call at 1-888-245-1311. I look forward to hearing from you.